Friends, in my previous program, I have discussed what is type 2 diabetes. There are two types of diabetes as I have mentioned in my previous program, type 1 diabetes and type 2 diabetes. And type 1 diabetes is insulin dependent. Without insulin, they cannot survive. So how to identify that the person is type 1, is a type 1 diabetic person? How to identify? At any point of time, random blood sugar, if it is more than 200 milligram percent, I repeat, is a young person, maybe 10 years, maybe 5 years, maybe 20 years, very young person, and suffering from repeated infection and frequently hospitalized, and the doctor examine the random blood sugar. If it is more than 200 milligram percent, then it is type 1 diabetes. They cannot survive without insulin. That's why they are known as insulin dependent diabetes. Now we don't say insulin dependent, non-insulin dependent diabetes, we don't say. Now we use the term type 1, that is insulin dependent. Type 2, it is non-insulin dependent diabetes mellitus. Now that is about the type 1, how to identify type 1 and type 2 diabetes mellitus. Now the question is, see, everybody, repeatedly in all my programs I am mentioning that everybody should know that blood sugar, fasting blood sugar, should not be more than 1 to 6 milligram percent. I gave the reason also, and I explained why it is known as 1 to 6, because WHO said it should not be more than 140. American Diabetic Association observed that with 140 milligram of fasting blood sugar, the persons, those people, they have developed the complications. So they said at least 10% less than that. So 140, 10% of 140 is 14. So 140 minus 14 is 126 milligram percent. And then the postprandial blood sugar, it is 200. WHO also said 200 milligram percent. But the renal threshold is 180. So often the doctors will be telling the postprandial blood sugar. See, they have taken the breakfast. 9:30 they have taken the breakfast. 10:30 or 11 o'clock, their blood sugar, if it is more than 200, then they are diabetic. Fasting, if it is more than 126, then they are labeled as diabetic person. Now the question is how to prevent or how to control diabetes. Yes, we cannot treat diabetes. We can only treat the condition. There is no cure for diabetes. Say for example, the person is suffering from malaria. We give treatment for malaria, and he will be no longer malaria patient. The patient is suffering from typhoid. The doctor has given the treatment, and the patient is no longer typhoid patient. Yes, those are all communicable diseases. Now the more and more, see, all the communicable diseases are under control, except now we are having the very dreaded communicable disease, that is the coronavirus. So these viral infections, it is little difficult to control, whereas most of the bacterial infections, we give the treatment, antibiotics, and we can control. So this how to control diabetes. Control diabetes means if the blood sugar, if it is fasting blood sugar less than 126, postprandial blood sugar, if it is less than 180 or less than 200, then full life despite diabetes. In spite of diabetes, the person, if the blood sugar, if it is under control, he will not develop any complications and he will lead a full happy life. He is comparable to any other healthy person. So then how to avoid